rock and roll. Dr. Jarvis, do you have just a quick update on kind of where things stand operationally in Northern Light hospitals as it relates to COVID-19?
So, you know, one of the good things is that we've been seeing a steady decline over the last few days in hospitalizations. Still, people who are coming into the hospital are severely ill, and so that's something people should understand, that this is still a severe disease. But maybe at least for the regions that we serve, we're seeing a little bit of a downturn. But at the same time, we know that community spread is still high. Our positivity rate is still, it's not as high as it was a few weeks ago, but it's still incredibly high and higher than we saw for most of the time last winter. So we know that it's out there, and you know, people still need to try to be safe. And if you're not yet vaccinated against COVID-19, you really need to get vaccinated to protect yourself and your family.
You know, we are approaching flu season. I think this is a big question that a lot of people have. I know that we've talked about it a lot, just between different briefings and advisories from the CDC and so on and so forth. But, you know, in your opinion, it's okay to get your flu shot at the same time as a COVID-19 vaccine?
Yeah, absolutely. So I know there's a little bit, you know, people remember that in the very beginning when we started giving out COVID vaccines, you know, we had said that there needed to be a 2-week delay on either end of a vaccine before getting a different vaccine. But we learned a whole lot more since then. And as we talked about in lots of areas with COVID, you know, our knowledge just continues to increase. And so, yes, it is safe for people to receive both their COVID-19 vaccine and their influenza shot at the same time. And if you're one of the people that fit the category for a booster for the Pfizer vaccine at this time, it's okay to get your booster shot and your influenza shot at the same time.
Gotcha. I know you appreciate people who do their research, so I didn't want to ask you this next question without actually looking at it. I know that you guys, the most recent post you guys had on the hospitalization stats was October 1, which I think was Friday. We had 29 people who were unvaccinated, 37 who were vaccinated that were COVID-19 patients hospitalized. And you know, then as you look at the ICU and the ventilators, you know, we had seen, I think David had brought this question up to you about a week ago Wednesday about, are we seeing larger numbers of vaccinated people going to the hospital? What are you seeing as a trend?
Yeah, so we are definitely seeing some vaccinated individuals who are coming into the hospital. For the most part, you know, their severity of illness is less than those that we've seen with the unvaccinated individuals. We have more percentage-wise, we have more unvaccinated individuals in our intensive care unit and on ventilators, and that actually held true for today's numbers. Our total overall number of people who are admitted to the hospital is less than it was on Friday. That's good news for everybody. And then those that are vaccinated who require hospitalization, most of them have some other kind of medical condition that may predispose them to being a little bit more immunocompromised. That's not universal. We obviously have had some young, healthy people who have been vaccinated who have gotten sick. But that, you know, that will continue. We know no vaccine is 100%. But truthfully, the majority of Mainers are now vaccinated, and so if the vaccines weren't working, you would expect that there would be more vaccinated individuals being hospitalized over unvaccinated, and that really hasn't played out as we look at state numbers. There's always going to be a little bit of variability in there, and as our numbers get lower, then statistically they become less significant in changes, and that's really what I think we're seeing right now across Northern Light Health, because again, thankfully, we don't have the same numbers that we had just a week ago.
Can I ask you a super quick favor? Are you on a laptop or a desktop?
I'm on a desktop.
Do you have a webcam? Is it possible to kind of tilt it down, just kind of to close the room between the head and the top of the frame?
Yeah, it got moved today, so I think that was part of the problem. Is that better?
Yeah, that's ideal. Thank you. As it relates to flu, there are some similarities, right, with the symptoms that a person might see, kind of that cough, sneeze, fever. I think the big question for a lot of people as we head into kind of the peak of flu season over the next couple of months, how do you distinguish whether it's flu or COVID-19, and what should you do as soon as you start seeing symptoms of whatever one it is?
Yeah, so clinically it is often difficult for us to distinguish between the two because they share a lot of similar features when it comes to symptoms that people have. And so with that said, testing is the best way for us to know exactly what's going on with an individual. which is why, particularly if somebody has a febrile illness, they have fever, along with cold-like symptoms, the runny nose, cough, congestion, or difficult breathing, then they really need to reach out to their provider or go to one of our testing locations in order to be able to get tested, because we do really need to know the difference about whether this is influenza or COVID-19. The treatments for the two are different, and therefore you need to have that in mind. So this is especially those who are more susceptible to severe disease, so those people who are over the age of 65, those people who have any underlying medical conditions that may make them more susceptible to respiratory viruses, and so those individuals definitely should get tested, and that is our best way of knowing what's going on in that individual. And of course, it makes a difference for the other people in the household. COVID-19 is far more infectious than influenza is, and so we want to make sure that if somebody's positive for COVID, we're protecting everybody, and not just the individual who has the positive test. And then, of course, like I said, treatments for influenza and COVID-19 are different.
There are some symptoms that we know about COVID-19 that I don't think are the same necessarily. Oh wait, no, I'm wrong here. Looking at the CDC website, the loss of taste or smell. It seems like it's more frequent with COVID, though, right?
That would be correct. So COVID-19, and again, with the prior variants, when we started talking about the original COVID strain and the Alpha variant, it was pretty predominant that people had a loss of taste and smell, and that was almost the hallmark for a lot of individuals. That was the first symptom that they really noticed in themselves before they got sick. We don't typically see that with influenza, but it's certainly possible with any respiratory virus that it can affect, because most taste is goes hand in hand with smell. And so if you lost smell because of the infection, you might notice a difference in taste. But really with the Delta variant, while we still hear people talk about loss of taste and smell, it does not seem to be that the one thing that kind of tells them that they're sick. And a lot of that has to do with the other symptoms coming a little bit earlier with the Delta virus than what we saw with the original strains. So just because you haven't lost your taste and smell doesn't mean that you don't have COVID-19, and just because you did, it doesn't mean that it's the flu, that it's not the flu. So again, they mirror each other very, very well, because again, they're both respiratory illnesses. What we do see with COVID-19 is and after you get sick, that it then affects far more organ systems than influenza typically does. But really, for the most individuals, they are pretty much indistinguishable.
I was on mute. I was trying to block out the background noise. That's got to be tough for doctors, right? Who are tasked with diagnosing, what does this person have? And so it seems like, based on kind of the way that the symptoms kind of play out in terms of development over a course of time, that it might take a couple of days to realize if it's COVID or flu. I mean, obviously you have testing, but I mean, what's the challenge there for doctors as somebody who comes into a hospital with all these symptoms and they say, I really feel sick?
Yeah, so the challenge there, of course, is that, again, like I said, treatment is a little bit different for each of those, and so that's an important factor. And also quarantine periods are different. The incubation period for influenza is very different than the incubation period for COVID-19. And so when we're talking about trying to isolate individuals within a hospital to prevent spread to other patients or to our staff, we have to take that into account. And then, of course, it's just simply overwhelming the system. And so again, this is a great reminder that flu shots are so important, because while most people do well with influenza, we do know that there is a significant amount of hospitalization and death from influenza in the state of Maine every single year. And so that just adds to the burden that our hospital systems are having right now in managing not just COVID-19 patients, but managing all of the other things that need to be in an acute care facility. And so again, if we have a bad flu season and it just takes a few people to cause a bad flu season, then that's just one more hit to the resources that are so precious right now. And the best way, again, to protect ourselves is with vaccination. So vaccination against COVID-19, vaccination against influenza, washing our hands. One of the things that we saw last year was a great decrease in influenza, and that was because lots of people got vaccinated because they heeded the warning we gave, but then also all the precautions we were doing to protect ourselves against COVID-19 worked to prevent spread of influenza as well. So hand washing, wearing masks, physically distancing where appropriate, not traveling and going outside your home when you're sick. These are things that help not just prevent COVID-19, but all respiratory illnesses, including influenza.
Is there, I mean, and I guess I should just ask, are doctors concerned that now that there's no longer this state of emergency that requires several of those layered techniques, that we could see a worse than last flu season is a weird relative term, but maybe 2019. I mean, are we worried about seeing a lot of patients coming into hospitals with respiratory illnesses this flu season?
Yeah, we are. And just to kind of take a look at this summer where RSV, or respiratory syncytial virus, a virus that typically causes colds in adults but causes some severe respiratory illness in children, typically we don't even see RSV through the summer months. It's usually a fall and winter virus. We saw huge spikes in that, in some areas greater than what we would see in a normal year. And a lot of that had to do with the fact that, the beginning of the summer, COVID seemed to be under control. And so people started to get out and about again. As you said, people started to wear masks less. They started to congregate more. Guess what? Respiratory viruses love those conditions. And so we saw RSV go through the roof. We do not want to see that with influenza, where we're talking about not just severe disease in children, but severe disease in just about anybody can occur with influenza, particularly the elderly. And we just don't want to see that. And so that is our fear. And that typically happens with influenza. We'll have a mild flu season, and then everybody lets their guard down. And the following year, we have a bad one. And so last year was a great year, but we want to keep it that way. So please get vaccinated. Please take all those precautions. And definitely, if you're ill, stay home.
Okay. Seems like maybe, I don't know if there might be a little bit of lag. Can you just give me a quick mic check real quick?
Sure. Can you hear me now?
Yeah, having a little bit of a video lag, but it should be okay.
I'm kind of seeing on your end. I'm not seeing it on mine.
Okay. 1 second. Let me check something. I think we kind of caught up to speed there. Let's
okay.
We'll finish up here. I did want to just get your opinion on something that came in from the Department of Labor, because I know that Northern Light Health supports universal masking in schools. It seems kind of unclear. The Department of Labor, I don't know if you remember this, but President Biden had announced, I think it was back a couple of weeks ago now, late September, about the 100 employee mandate for vaccines.
Yep.
or the testing option. We've been trying to clarify with them, does this mean, that 100 employee threshold, is that school, campuses, or is it districts? Now, my gut tells me you're employed by the district, so it probably is district. But they're basically saying, yep, we're gonna make a rule that says your employer's got to pay you for time off to get the shot, got to pay you for time off if you feel sick after the shot, and that Maine, because it has that state OSHA plan, those school staff and educators would be required to do the vaccine or weekly testing option. I just wanted to get your reaction to that, knowing that you've been, a strong supporter of protecting kids in schools, especially during COVID.
Yeah, absolutely. So I've always supported that, any eligible individual, and that would be teachers, staff, and students who are eligible for the vaccine, should get vaccinated. It helps to protect those that are in the school as well as the rest of our communities. I can't comment specifically on the Department of Labor, OSHA, or the Department of Education of any of what those requirements can or might be. But definitely at Northern Light Health, we support vaccination in just about every circumstance, and certainly would support vaccination for anybody at school who's eligible for vaccine.
I did have a reporter who's working on a University of Maine system story, and she was telling me, I guess that the health staff at the school said that they mostly work through, they're like associated with Northern Light. So she wanted me to ask you these questions, if you don't mind. I think they're pretty straightforward. Basically, how important is it that the University of Maine campuses reach a certain level of people vaccinated? I think she means a percentage of people vaccinated. Is there a difference at a college campus? I guess is probably
and it is different in a college campus because you're talking about a congregate living situation. So it's not just a household or even an apartment complex. It is a large number of people who all live in a single dwelling, and so that if one person was to get sick, it could spread pretty rapidly. And again, those people are somewhat isolated from the rest of the community, because not only do they live together, but then they go to school together. So it's almost as if they're working and living with the same group of people time and time again. And so it does make it so that spread can happen across college campuses very rapidly. We saw that around the country last year. Thankfully, we did not see that very often here in the state of Maine with our university. universities and college systems, partly because they very quickly adopted health practices that help prevent the spread of the disease, and that's an important factor. And now, of course, we have one more thing that we didn't have last fall, which is vaccination, and most college individuals are eligible for vaccination. And so, there is that level of protection, and certainly I applaud the University of Maine system for mandating vaccination for their students, and I believe the deadline for that is coming up very shortly.
It is, and I think that's why she was focusing on this today. I think we just kind of talked about your concerns about college campuses in the state and vaccination rates among faculty and staff. Well, we talked about students. Is there anything different for faculty and staff that you want to add about them being vaccinated as part of a college campus?
Well, it's important for them to get vaccinated too for a couple of reasons. They tend to be older than their students, and so therefore they may be at risk simply by age. But also they're also returning home, and so that if they were to pick up a virus, particularly COVID-19, while teaching at the university, and then return home and infect people in their home, in their community, that just adds to the spread. And so, it's just as equally important that everybody who's eligible get vaccinated, because that's how we decrease the overall volume of virus out in our communities. That's when spread decreases and things become far more manageable.
Okay, my last question for you, because I promised I would be respectful of your time, and you've been very generous with it. I always like to ask this question whenever I'm speaking with a public health official, especially these days, because I don't know if you've seen, we do a verify segment where we kind of go straight to our firsthand sources to debunk a claim that you might see on, social media or something that's been out in the, kind of the public discussion. So is there a single piece of misinformation that you or your other staff hear the most from people who are hesitant to get the vaccine?
Yeah, I think a lot of it is that these vaccines are new, and therefore we don't know the long-term safety effects. I think that would be probably the number one concern that I hear. One, the technology for the vaccines is not new, nor was the technology to create a coronavirus new. They've been working on that since the SARS epidemic, the first SARS epidemic. And so the vaccines were already somewhat underway, and the technology has been used for decades. And so that was already there. But when it comes to long-term effects for vaccines, almost any long-term effect for vaccine is seen within 8 weeks of administration of the vaccine. So we now have individuals who have been vaccinated for well over a year. Those are those that were in the original study group. And then you have healthcare workers, first responders, and others who have been vaccinated now for well over 8 months. So far beyond the time frame that we see where long-term effects from vaccines occur. And so that's why we know that the safety profile for these is incredibly good. They're very safe vaccines. And we probably have more data than we did with any other vaccine prior to coming to market. And so, if your fear is that we just don't know what's going to happen with these vaccines, we do know, and we do know they are safe.
And this is my last follow-up, just based on all this. There are lots of different reasons for somebody to choose or not be able to get vaccinated, whether it's a medical exemption, a potential religious exemption, but also politics and all other philosophical reasons. How much would you say misinformation has played into the hesitation from people to get vaccinated? Does it account for a certain percentage, or what's kind of your sense on all that?
I think it's actually a high percentage for people who are hesitant. And I've spoken to many individuals on a one-on-one basis, trying to either for myself glean why they're hesitant, or for them to ease the concerns and fears that they have. And almost inevitably, something will be brought up that is just not factual. And so it does play a major role for most people, but the primary reason is fear. And I think this is when we all have to find a trusted source that's reliable, knows the information, and that you can believe them, which typically for most people is going to be their primary care provider. And so I implore people to reach out to them, and then you can certainly reach out to sources like myself or other sources that most of the time are the sources that people do trust. I would not be having my family get vaccinated if I had a fear or concern that it was not the right thing to do, and yet my family is vaccinated. And I feel the same way about my coworkers, my friends, my family, and my community.